your mind so that the communication can flow easily among participants.
Do you have any unwanted reaction?
If we can ask all to mute your mic. Thank you. Welcome to this webinar series, Making Epilepsy a Health Priority in Africa. We're going to be having a series of such webinars. This is the first of its kind, where we're talking about epilepsy in Africa. Today, we're also talking about the involvement of media in the advocacy work, and also looking at some best practices on how we can engage governments to be on board. Shortly, I'll be introducing the three panelists that we have today that are going to make the presentation. We are very excited and interested that you have managed to join us today for this webinar, knowing that we all have different interests. Personally, I have an interest in epilepsy because I'm a person with epilepsy myself. Despite that, I'm the Vice President of International Bureau of Epilepsy for Africa. But just because I have epilepsy, I start thinking about my journey up to where I am today, the challenges that I have faced for me to be where I am, and think about those boys and girls that are still not having treatment, that are not accessing medication, and so forth. So all of us have got a different interest. We have researchers, we have some I've noted from the pharmaceuticals, we have some from the development committee, we have some that are affiliates of IBE, and different partners. So we all coming from different backgrounds, and we are happy that you have managed to join us today. And we're looking forward to a fruitful discussion with you, where you can help us, to map the way forward in ensuring that epilepsy can be on the health agenda in Africa. We are excited currently in the work that we are doing as IBE-Africa. We've got two key projects that we are currently running, and these projects are supported by BEN Foundation, who are our key partner in the work that we're currently doing. One of the projects we're running is called Promising Strategies, where we are looking at innovative ways on how people or how organizations and persons with epilepsy can replicate the work that they are doing in their countries. Currently, we have sub-granted 6 countries that are working on initiatives on epilepsy. And we hope at the end of 12 months, we'll be able to have best practices and good models that we can replicate in other African countries. The second project, Making Epilepsy a Health Priority in Africa, has again sub-granted 4 countries that again will be working on models on how we can ensure that epilepsy is on the agenda. So this series of webinars that we'll be having starting from today will be shaping up and giving ideas on how we can ensure the visibility of epilepsy on the African continent, as well as on the policy tables of those that matter, to ensure that epilepsy is going to be on the agenda in Africa. So before I introduce the first guest speaker, let me just share with you some housekeeping matters. So just to let you know that this webinar is being recorded, so you don't need to worry to ask about it. We'll be able to share this webinar with those that would want it. We also have a question and answer session at the end where we'll have a discussion, but we'll be so much happy if, as we will be discussing, there's a chat section. Can we use that section to send our questions? As we'll be discussing, we'll have an opportunity to be answering some of those questions. As you know, we're expecting quite a number of people, not less than 40 or up to 50. So we might not be able to answer all the questions that will come, but we'll ensure if you drop in your emails as well, will be able to follow up with some of the answers and also get these answers from those people that are going to be making the presentations today. So may we all mute and pay our attention to the first and guest speaker, who is Dr. Florence Baingana. Dr. Florence Baingana is a seasoned mental health specialist with also special work in epilepsy work. She's a researcher. She has worked for different organizations around issues to do with mental health. Currently, she's with WHO, the Afro region, and she's responsible for the mental health section, responsible for policy. And we are glad to have her today. And we're looking forward to her presentation entitled Epilepsy in Africa Today. Where are we with epilepsy? Why are we still having these challenges of treatment gaps? She'll be able to answer some of those questions. So may we all pay our attention to our guest speaker, Dr. Florence Baingana. Dr. Florence Baingana, it's your time. Thank you.
Thank you very much, Action. Am I sharing my screen or is somebody else going to? Should I use my slides?
Please, yeah, just go ahead and share. I'll ask Anne to share.
Oh, yes. It says only the host. I will have to wait for them to allow me.
Okay, I'll ask Anne to.
There we go, 2 seconds, it's coming. Right. Okay, thank you very much, Action. And I'm so glad to see so many of you here. Mine, I believe, is 15 minutes or so. I will try to run through my slides. My presentation is Epilepsy in Africa Today, the WHO perspective. The outline is I will talk about the state of mental health services in the Africa region, the burden of epilepsy, WHO interventions for the management of epilepsy, and then what can civil society organizations do? What can they do in their advocacy efforts to strengthen epilepsy services in the region? I just start off with this one slide that shows us Africa and the state of emergencies in the WHO region, because I don't want us to think that epilepsy is the only thing on our agenda. Right now, 47 out of the 47 countries in the region are actually affected by COVID, and I'm sure all of you know, I see some of you are wearing masks. So we have all these different emergencies in the region, and so epilepsy is a big problem, but we have to recognize that we are competing with very many other issues, not just even emergencies, but we've also still got HIV/AIDS, we've still got malaria killing people, women are dying giving birth, and all the other mental health conditions, not just epilepsy. So in talking about epilepsy, we have to also talk about it in the context of mental health overall. I know we all know that epilepsy is a neurological disorder, but for the longest time, WHO has included mental and neurological disorders together. Because very often, especially in our own region here, when you hold a mental health clinic, you're going to find up to 60% of the people in your clinic, or even more, are actually people living with epilepsy. So we need to look at what are the resources that are available for mental health. And within those resources, then we see what resources are available for the management of epilepsy. So if we look at the Africa region, here I did not include everything I could have talked about because of the limitation of time. I just picked a few things here and there. So here we look at countries that reported on human or financial resources in their policies and plans. That's the column on in the middle. Africa, 62% reported that they include human or financial resources. But if you look on the right, you will see that only 27% actually allocated anything to mental health. If we look at how much was actually allocated, I wonder whether you can even see the Africa portion. The Africa portion shows 0.1. That is the average, 0.1. And it's the same for other low-income countries. So it's not just Africa, but we know that most of the low-income countries actually in the Africa region, but also include some of South Asia. But you can see that while 27% allocate something, that allocation is that low. If we look at who is it who pays for mental health services, the countries are reporting that 57% are fully insured or it is tax-based, 57% of the countries. But we know that these services are actually tax-based, and there's another slide on epilepsy that will show how much people actually pay towards mental health and towards epilepsy. These two, I will run over very quickly, but you will see that as you move from the left, you move to the right, you move from low income to high income, and the allocation to mental health increases as you move to high income countries. So what this means is we have to work, as we work to improve the economies of our countries, we will be able to hopefully increase the allocation to mental health and even to epilepsy care. But we also know that people who have these conditions, unfortunately, may not be as contributing as much as they could, mainly because maybe they are home, not able to go out to work because they are not feeling very well, or they are not getting jobs because of stigma. So it's like a two-way relationship. But that one is I think is very indicative of why we see that so few of our countries are allocating monies to mental health. This one looks at mental health beds, and it's an important one because we often talk about cutting down mental health beds. The global average is about 16 beds per 100,000 of the population. In Africa, we have 2.5 beds for mental health. So while we may think we may need to be cutting down, I think we also have to be cognizant of the fact that we actually have very, very few beds to begin with. So we do need to strengthen mental health and epilepsy care at the community level, but we also need to be sure that we have adequate beds for those who need to be admitted. This one talks about the mental health workforce. And it's an important one because, again, you can see Africa is very low there, about 0.9 of a person, 0.9. We don't even have a full person for 100,000 of the population. But what is this 0.9 actually made of? That's on the left. On the right, you see what is it made of. It is made of about 1/3 being psychiatrists, about 1/3 being nurses, such as psychiatric nurses, and then about another 1/3 are people we cannot really categorize. So most of these people are actually non-specialists. We are not talking about general healthcare workers here. You know, very often in our mental health institutions, we have people who are called nursing aides. And I'm sure all of you in the African countries know about these people trained on the job who are there to manage the patients. And that forms about 1/3 of the human resources. You can see on the left-hand side in the Africa column, you can hardly see the numbers for instance, child psychiatrists or other specialist doctors, or even clinical psychologists. It's a very, very narrow band. So we do have shortages in all these other areas. When we come specifically to neurological disorders, and we are talking now specifically about epilepsy, on the left-hand side, you can see there where I have tried to circle. That one shows how many people with neurological disorders present at the primary care level. So the numbers may be a bit small for you to see, but you can see that it's about 87.5, 88% at primary care level. In the right-hand side, you can see that even at tertiary care level, they form the majority of the patients for the Africa region. Okay, so in the Africa region, epilepsy is the commonest disorder at both primary healthcare and tertiary level. So while the incidence of epilepsy is 40 to 70% per 100,000 in high-income countries, in the developing countries, it's 100 to 190 per 100,000. So you can see if you multiply how common epilepsy is. 80% of the total burden of epilepsy is in the developing countries, 80%. And this is really because of the quality of the healthcare services that we have in the Africa region. Most of the epilepsy that we have is secondary to something. It is secondary to difficult deliveries. It is secondary to infections like tetanus. It is secondary to untreated cerebral malaria, for instance. So if we can't control these common conditions, or if people are not immunizing their children, so the quality of the healthcare service is what leads to the epilepsy that we see. Neurological beds, as I had talked about, mental health beds, you can see neurological beds. You can hardly see it where the arrow is pointing there on the left-hand side. On the right-hand side is neurologists, and these are even fewer than the neurological beds. So neurosurgeons, neuropediatricians are even fewer than the neurologists. I did not show those, but you can get all this information from the WHO Neurology Atlas. I got the one for 2004. It's rather dated, but I believe that not very much has changed since then. Unfortunately, we also have very few places that train neurologists. At that time, they were saying 0 now that do train neurologists, but they are still very few and far between. When we look at financing and essential epilepsy drugs, you can see on the left-hand side, first of all, that the primary method of financing in Africa region is out of pocket. That shows that arrow up there shows that it is primarily out of pocket. And that is the lower arrow as well, showing that about 84% is out of pocket, yeah, for the low-income countries. So while for mental health, we seem to be saying that it is tax-based, the reality is that people are actually paying out. And compare this to, I don't know if you can see the little blue arrows that I put in for the higher middle, the lower middle, and the high income countries. Most of it is financed from tax-based as well as from social insurance. But because in most of our low income countries, in most of Africa, the tax base is so low. And those who are in formal employment are also very few, and so we have very few people on insurance. And so social health insurance, if it includes mental health and includes epilepsy, covers only a very small portion of the population. On the right-hand side, we have epilepsy drugs, and it looks like a very promising picture because we say we have at least one anti-epileptic drug at primary healthcare level in 84% of countries. That looks like a big number, but we know that one drug is phenobarbital. Phenobarbital may be limited in the number of conditions that it will cover. It also has a lot of side effects, and many people put on phenobarbital may discontinue it, especially young people, students. Do I still have time, or I've gone on too long?
No, you can continue. It's okay.
I'm about to wind up.
Yeah.
Yes, I'm about to wind up. So while we have one drug, phenobarbital, very often the health unit is provided one tin of 1,000 or so, and this is to last 2 months. And so often we have stockouts of even this one drug. So what has WHO done about it? So WHO, working with IBE, put out this report last year, and it's available online. I hope all of you will be able to download it and read it. It is available in English. It's also, we have the summaries in those different languages. One thing that it included was the trends of what has been happening over the years. You'll see 1997, there was a gap between that before we came to 2000. And now as we came closer and closer to 2015, then 2017, 2018, more and more things going on there. And now we are at 2020 and there's still even more things going on. One of the important things included here in 2008, you will see that WHO put out the MH-GAP manuals, and many of you may know about MH-GAP. MH-GAP is a task sharing, task shifting process where we train lower level healthcare workers to manage common mental disorders, and we included epilepsy within that. So every healthcare worker, even at the lowest level, should be able to get MH-GAP training and be able to treat epilepsy. We also have the 68th World Health Assembly, which adopted a resolution on epilepsy, which was really important. And this resolution was emphasizing the importance of training non-specialist healthcare providers to reduce the epilepsy treatment gap. It also included strategies to improve access and affordability of anti-epileptic medications. So two very simple things. There are many other things in there. You can find that also on the WHO website. The other one is the WHO Assembly report on addressing the burden of epilepsy and other neurological disorders. This one came out in July 2020. So it's just a few months away. So we haven't been quiet, and I know we have been working very closely with IBE and other partners to get these things going. I would encourage you all to read these reports because we have another resolution that should be coming up here. So I will not go into that. So what can CSOs do to make epilepsy a health priority? I think one, and the very important one, is to establish what the key gaps are in your countries, and then create a coalition to advocate for the gaps to be addressed. So it's really important that the CSOs get together. CSOs working together with other CSOs, but also try to work with the government. So look for what are the gaps. Every country may have different kinds of gaps. The anti-epileptic drugs available at primary health care, that could be a question. Are healthcare workers able to manage people with mental health problems at primary health care? That could be a question. And if you find there are gaps in these two areas, these are the commonest ones, then you could begin an advocacy campaign. You could also look, is epilepsy in the mental health policy and the mental health strategic plan? If it is in the mental health policy and strategic plan, is mental health per se prioritized in the health policy? Because it is like a cascade, yeah? So if mental health is not prioritized in the health policy, even if they include epilepsy, it would still be a challenge. So that's why we all need to work together to create a coalition where we advocate for what needs to be done. So thank you very much. I'm happy to take questions.
We want to thank you, Dr. Florence Baingana from WHO, for sharing us an insight on the current situation, status of epilepsy in Africa, as well as what WHO is currently doing. And it was good to note that we still have some challenges. We have noted issues to do with support in terms of resources that are allocated to epilepsy work. The workforce support for workforce is also not available. It might be those that with a specialty in epilepsy. It might be even those at primary health, primary level, as well as community health workers. The knowledge also is not there, and we have noted also the gaps in terms of the ratios that are there in terms of specialists that are working currently in Africa. And we have seen the prevalence currently as recorded by WHO. It's, as they've said, almost 0.19 of all 0.19 of the African population. So we're talking about 1.3 billion. So about 0.2 of that population is actually living or they have epilepsy, which is a cause for concern, and there's a lot of work that needs to be done. But we're also excited with some of the suggestions that WHO is presenting, which as IBE and other partners working in Africa, we have also been pushing for the issue to do with working with unified voices in, at country level, where we need to be identifying the gaps that are there. Who are the partners that we can work with at country level? We have also noted the issue to do some situational analysis. As you know, advocacy work also requires that we provide evidence-based information to those that we are advocating to make a change. So all this is also what WHO is encouraging us to continue doing. We're excited that Dr. Baingana also mentioned about the WHO resolution, the 6820, which will be discussed in the upcoming months at the World Health Assembly. So as African countries, we need also to start talking about it, as well as also start asking our governments if they are supporting this resolution, because it's important that when this resolution is discussed at the General Assembly or the WHO Assembly, we have our voices as Africa. So this is the right time now where we need to be engaging our governments. We've already circulated communication to that effect. And please, if you need assistance, get in touch with IBE-Africa or International League Against Epilepsy to ensure that you get the support you require in engaging with the relevant governments. So for now, before we move on to the next speaker, who was having problems to log in from South Africa, Mr. A.K. Dube, while we check if he has managed to log in. Let me invite participants, if you have got questions to the presentation that we've just enjoyed. So we can show by means of hands through the digital hand raising. So if you are using a computer or your phone, you'll see there's an option where you can raise your hand. And if you cannot, then we'll be able to take questions through the chat section. So I see a hand from Chantel. So let's give the first option to Chantel.
Yeah, my name is Chantal. I'm working on behalf of the mental health, the epilepsy in Rwanda, Global Epilepsy Connection, which work also in collaboration with the Rwanda Biomedical Center, the department of the Ministry of Health, which represents the department of that particular disease, like a mental health. But what I have in question with Dr. Baingana is to find a way that we found difficult in Rwanda to present to ask about the action plan to give to the because every year we need to go through the resolution of the WHO. But I need her help to find a way we can pass that to the government, and the government to consign that policy of mental health to be sent also to the resolution of IBE in February. Because we try with one of my colleagues, Fidel Severa, but we could not get the answer up now. But what I say, example, the weakness and the gap we have in Rwanda, we have the drugs, the availability of the drug example, but we do not have more trained doctors, especially in mental health, to take training abroad, like the way they can link themselves to other training in IBE or other international network like a UCB on research. So we do not fund exchange of data research between such data scientific to patients, and there is a huge gap. And the problem we have actually with COVID is malnutrition. So how those patients can swallow those drugs without food? Thank you so much.
Okay. Thank you, Chantel, for that question to Dr. Baingana on how organizations for persons with epilepsy can work with WHO, assisting them to advocate to government because at times there's no response from government. Okay, let me take another question. If there's another question, then, okay, for now, okay, there is no other hand. Maybe Dr. Baingana, you might want to address that question.
Okay, thank you very much. I'm very sorry to all of you. I hope you got to the end of my presentation. The internet went off. But that's a very important question that Chantal asks, is how to pass on what message we want to pass on to the government. And that's why coalitions, advocacy coalitions come into play. It is not something that can be done by only one organization or one group of people. So it needs a coalition of different stakeholders. You may need to include maybe even the professionals, maybe even the pharmacists, maybe psychologists, neurologists, and all the different NGOs. There may be NGOs that are of people living with epilepsy, but they could be other NGOs that represent maybe children who have epilepsy. So our coalition always has a stronger voice than just one individual NGO. The coalitions come together for a short period of time to deliver one specific message. Once it is achieved, they don't need to be together again. So it's not like an NGO, it's just a grouping of people coming together to advocate for something. So once you have determined what it is that you want, then you have that message and you decide how are we going to pass on the message. One way could be having different sessions to talk to different groups of people. You can also do a media campaign talking through the electronic media, social media, television, radio. You can do a lot of that. Other people on big days, World Epilepsy Day, you could decide to have marches through town and request for a meeting with the Ministry of Health as well. In all these different activities, you could request for a meeting with the Ministry of Health. But first of all, build up the momentum, have things written in newspapers, have talks on radio talk shows, TV talk shows, media campaigns, sending out messages. So I'm sure Action will have a whole strategy document, whether developed already or in the process, that would support you in developing an advocacy campaign.
We did it. Thank you so much. We did it, but you know, the RBC, the Rwanda Biomedical Center, can give you the report about what we did on the journal of how we advertise through media and how we work in collaboration with the Handicap International and the other national unity for disabilities. But the problem we have, we need at least someone like you, who is very on top of the leadership of the mental health on OMS, to bring at least that agenda. Because sometimes when I can speak example me and the ELA and other organizations which look after the mental health in Rwanda, they are not on the same page. Even this book published by the IBE, I sent it to them, but they didn't get.
Hello?
Is it me? It seems it's not me this time.
Yeah, sure.
Yes.
Okay, so I lost Chantel.
But we need.
Okay, you can continue.
We need
Chantel.
at least a push.
You can wrap it up, yes.
Thank you. Yeah, we need at least a push, because at this platform, we have already agreed to open the National Bureau. And that National Bureau committee will be involved with a professional in health background. But the problem, those who are sitting on the bench of politics, how to get to them to let them know exactly this message you are giving. Because this platform, it involves me and other Zambia, Malawi, stuff like that. But I don't see anyone from the Department of Health of Rwanda who came here to listen to your presentation. Thank you so much.
Okay,
Yes.
thank you.
So if you form, if
yeah.
I could just briefly say, if you form a coalition until you get your result, you may need to keep advocating. And advocating may not be that you send a document. Advocating may be that you talk in the media and the message will get there. So it is a process. It is not that I will send a document to them and they will read it and they will change their minds. Because changing people's way of thinking is a difficult process. And I started off with highlighting the different burdens that we have in Africa. We don't just have epilepsy. So epilepsy is competing with mental health in general. It's competing with communicable disorders, with NCDs. It's competing with emergencies. So you have to form your coalition and then continue. Don't give up. My colleague would like to say something, if you would allow him, please.
Okay.
Dr. Sidi. Yeah. Dr. Sidi is my colleague from West Africa. Please allow him to also say something.
Thank you.
Thank you. In fact, I would like to highlight to our colleagues that WHO cannot put pressure on countries to implement the resolution adopted by the countries, because the resolution adopted at WHO are adopted by countries, by the ministries of health. So it is their responsibilities to implement those resolutions. So it will be good also to work with the Ministry of Foreign Affairs to see the status of implementation of the resolutions adopted by the country. So especially the Ministry of Foreign Affairs can send verbal notes to the Ministry of Health to remind them the resolutions they adopted and the implementation status. So it's always good to see and work very closely with, on top of what Baingana said, advocacy, but also work with the Minister of Foreign Affairs, department in charge of international organizations, to remind to the Ministry of Health what are the main implementation challenges about the resolutions and how to overcome. Over to you.
Thank
Thank you
so much.
Doctor, for that additional information. So there is need for continued advocacy, as well as knowing the key partners, and we've just heard that also we cannot only work with Ministry of Health, there's also need even to engage Ministry of Foreign Affairs in terms of resolutions that are passed. So all this needs to be worked on, and as we continue building our own capacity as chapters, I think these are some of the lessons that we're learning and areas that we need to improve on. Just another question that came through the chat is Dr. Baingana, you alluded to that epilepsy tends to be overshadowed by other conditions. So the question that came up, it says, what kind of additional support in terms of technical support can WHO provide in country to ensure that epilepsy is put on the agenda? That you might have touched it a bit, but maybe to put emphasis on it. Okay, we seem, Dr. Baingana.
Sorry, as I mentioned, WHO cannot do advocacy. What we can do, the role of WHO, and I think it was my colleague, Dr. Sidi, who said it actually, WHO is a membership organization. The members in this organization are the member countries. So the member countries are the ones who determine what we do. So when you happen to be in a country as a WHO staff, you're working on behalf of that government. That's why our primary partner is the Ministry of Health. So we cannot force the Ministry of Health to do something that they themselves have not prioritized. That's why in the advocacy area, if you remember, my two recommendations were, first of all, lobby your Ministry of Health, do advocacy so that mental health is included in the health policy, or it is included in a neurological policy if you have one. And then once you have it in your health policy, then the next step is to ensure that mental health is prioritized within the Ministry of Health. So every Ministry of Health says, this is the package of services we are going to focus on. Mental health should be included in that package. If it is included in that package, WHO has already included epilepsy in the MHGAP manual, because for us that manual is the package of essential mental health services to be delivered if a country has prioritized it. So all of it depends on the Ministry of Health prioritizing. So those two recommendations are very important. Just look at them carefully and think about them, and I think they will get you there.
Okay. No, thank you so much, Dr. Baingana and your colleague from West Africa for that input. I think we really appreciate. So talking about advocates, another arm of advocates that usually helps us is the media. So I want to invite Mr. Kudakwashe Dube, who is going to talk about the role of media in promoting epilepsy in Africa, learning from disability advocates. Mr. Kudakwashe Dube, interesting stories. He's a man who sat on the table with the likes of Nelson Mandela talking about disability. The day they went to meet President Nelson Mandela without any data or any evidence, and they were sent back to go and gather their data. So he's going to share us all those stories. Mr. Kudakwashe Dube is currently the Director General for African Disability Alliance. He's also the chairman of Africa Action for Disability Development and Disability ADD in UK, but working in Africa. So let me invite Mr. Dube to give that presentation, the role of media in promoting epilepsy in Africa, learning from disability. Mr. Dube.
Thank you very much, Excellent. I would like to acknowledge protocol and the representatives of the World Health Organizations and the leadership and activists from IBE-Africa. I would like to extend my warm regards and thank you very much for that introduction. I just wanted to say one or two things from what we were discussing just now before I move on to the topic. And that is to say, the movement of people with epilepsy in Africa is facing great challenges. And one of them is the fact that epilepsy is not a visible disability. And as such, very often their needs are not usually taken care of. And in fact, people with mental disability generally are not that active in our disability movement as it stands. And we need to do a lot more as people with disabilities, but also as people that have epilepsy and across the continent, to try and make sure that our disability movement is inclusive, and that we do not only look at the disabilities that are normally the obvious ones, like people who are blind or physically disabled. And then the second point that I wanted to make before I address your topic is the fact that Africa has resources, and it has also natural resources. It has got natural medicines, traditional remedies. I'm aware that in Malawi, they recently legalized a drug that would have normally been abolished, and I think that has to do with cannabis oil. And several countries are already legalizing this type of medication. Now, what we have to emphasize there is where opportunities like that arise and which have something to do with our disability, it is essential that we as people with epilepsy, as people with disability, we are able to make use of those opportunities, and working with the World Health Organization, the health sector in our countries, we are able to play an active role in looking for remedies and solutions. Very often we look at ourselves as simply people that must receive medicines. We must just receive medicines and use them. But how about if we changed our perspective and said, where we can produce and contribute to the production of medicine, then we must be in the forefront of that, because it's about our lives. Now, some of the medicines that were previously banned, as I said, are beginning to be legalized. So those two issues, I thought I should highlight them for IBE-Africa to start really seriously looking at economic empowerment opportunities that will also benefit the health needs of people with epilepsy in Africa. Now, let's come to the issue of the media. We have a number of sides to the media, electronic, now social media, as well as print. I know that newspapers are struggling. They can't compete with online newsletters or online newspapers. But however, the media will always continue to play a useful role in any advocacy campaign. There are two objectives here. The first and primary objective is to ensure that our media policies are able to define and use correct words when they are talking about us. So in other words, I can foresee a situation where we look at all the media houses on the continent and then say to ourselves, are they aware of what they should be reporting on? One of the problems that we always have with the media is that they use words like insane, mad, and those kind of words, they don't help with our advocacy, because they actually exacerbate the problems that we are currently facing. And in order to change that culture, we have to start with media houses themselves. And not the reporter, not the news taker, but the media houses themselves. They must have a policy and a strategy within themselves as media houses which actually, and again, we can help them to cultivate, to prepare this kind of policies and strategies that clearly define what that media house stands for, or the role of that media house in promoting our advocacy strategies. So if it is taken at that level, then it means that should there be a change in personnel, in leadership, in the media house, then we don't have to start afresh to try and new people. Sorry, are you hearing me?
Yes.
Yeah, yes. We don't have to start educating new people that roll into these media houses, as there is a turnover of reporters and personnel and editors and so on, because it will already be a culture within these media houses. So what we should be aiming is to actually create an innovative culture in the media houses themselves, so that they can have policies and strategies and budgets that will ensure that the needs of people with epilepsy are taken into account, and that we use the correct language. We are able to communicate to society exactly what are the needs, what does it mean to have epilepsy, and does it mean that we are useless or we are not important? So the media has to shape the perception and beliefs of society. So we need media houses to have clearly defined policies and strategies. Now, the next level will be then the reporters themselves. In other words, the employees that are coming out of these media houses. Are they qualified? Do they know what words to use and how to report on the things that we are campaigning for? And we still see a lot of words being used in the media, which are making our struggle even more difficult because you see they keep on using wrong terminology and perpetuating the traditional negative attitudes towards persons with epilepsy. And they are, the media has to confront head-on bad traditional beliefs about epilepsy, and to educate society about exactly what does it mean to be epileptic. I want to thank IBE-Africa for arranging for me to attend your Congress, which happened, I think it must have been in Senegal a few years ago, where we spent an entire week looking at this subject matter of what is epilepsy from a medical point of view, and which part of the brain is affected, and so on. So that kind of knowledge is very important, not just for us as people with epilepsy, but for society as a whole, so that we can demystify this condition and ensure that we are able to work with, when people are in the community and they have got epileptic fits, they are able to be assisted locally. So, Chair, this is my comment on the media. We have to be there in all media channels and ensure that we also carry out a very thorough media campaign. As you know, Chair, you are on our board of directors, and you know that we have what we call ADAS network of journalists. ADAS network of journalists are journalists that are dedicated to promoting our work and to ensuring that our messages, once we send to one, we send to all, and that those messages are sent right across Africa. So that level of organization is what we need to ensure that we are right in the forefront of coverage with the media. Some of the TV stations are growing cross-border, and we should be looking at those and making sure that we utilize them. Thank you. I will be very happy to answer questions, Chair.
Okay, thank you a lot, Mr. Dube, for sharing those insights on how we can engage media. It's not only just an issue of sending stories and so forth, but it's also even issues to do with police within media houses, awareness to the reporters, to the editors, and also making sure that we are involved in the networks that are there. Yes, I'm aware of the African network of journalists, and I think we'll be also reaching out to them. So we want to thank you for that very good presentation, and we know that you are going to continue working with us as a partner in need, as we have already started doing so. Now, let me invite some questions from the audience. I can see Nina, you want to say something?
Hi everyone. I was just backing up what Mr. Dube had said. And the media does shape the way people perceive people living with epilepsy. So it's a very important part of the advocacy that we're supposed to do.
Okay, thank you, Nina. Nina is a person living with epilepsy, knows it very well, what it means when you're called names with the media, and also that they can shape the agenda in Africa. Maybe any other questions for Mr. Dube? Okay, there's one question that came through the chat, Mr. Dube, about the media with reference to disability movement and disability work. What other challenges have you faced in terms of engagement with the media? I think, as you know, in Africa, most media houses, they will not cover your story, they will not cover your issues, unless, you know, there's some allowances for them and so forth. I don't know, what other challenges have you faced as you are working with other Pan-African organizations within Africa? We know you have just ended a big project with EU. So what are the challenges in terms of engagement with media?
Right, thank you very much for that very good question. I think the challenges that we all face with the media, as you know, the media can build you, it can also destroy you. They are saying that says the pen is mightier than the sword. Now, with the media, the best way to work with the media is to make sure that we change the code. If they have a code, if they have a regulation, if they have any sort of like a charter of principles, if they have anything of a binding nature that binds journalism, it is important that we insist that we influence those charters and those principles so that they can be able to represent us well. And then secondly, the other problem with the media is that they look for sensation. So if I'm a person with epilepsy, they don't talk to me unless they see me having an epileptic fit. So for them, that is drama. That is something that will interest people and so on. And yet, you see, the media should be educative. And by the way, Chair, there is another aspect of media that we need to know in Africa. And I know that Burkina Faso was pushing a lot in this sector at the African Union. And that is the fact that we have state broadcasters. Now, these are public entities that are meant to public good stories of society and developments within society. And people don't have to pay subscriptions in order to listen to these state broadcasters. Like, for instance, South African Broadcasting Corporation is one such broadcaster. So you see, it's their duty to come to us and to take stories from us, and we don't have to pay them for that because their role is state broadcasting, not propaganda. Sometimes state broadcasters, then they don't quite understand what their role should be, and they end up advancing the government's propaganda machine. The truth of state broadcasting or public broadcasting is that they should cover the needs of all people and make sure that they are communicating accurate information and information that is constructive. So yes, that has been a major problem. And sometimes they don't just come, they don't come at all. And if they don't come to your event, then you have little media coverage. We ended up promoting journalism, as you will recall, Chair. Last year in December, we ended up saying, let's have a media award. If you can remember, Benjamin from Ghana was the inaugural award winner of this particular award, the Journalist of the Year award. Now, the reason why we do these promotional campaigns is to ensure that we've got the media on our side and that they are able to cover our stories widely. So that is that's what I would say is the best way to deal with the media in your countries. Thank you.
No, thank you a lot, Mr. Dube, for those experiences and strategies that you have used. And I think our chapters here and those that we are working with, especially when we come to advocate within the in-country as well as regional level, I think it's going to help us so much. There's also a question. Let me give the chance to Anita from Uganda.
Thank you, Amos, for this opportunity. I would like to thank Mr. Dube for his presentation and also share that I have a broadcast media background. I worked in the radio for 10 years and actually know how these people operate. One, we can't rule out the people who ask for money. You know, corruption has hit the roof in other countries, and our stories about epilepsy are not that attractive, and people wouldn't like to, they don't sell as such. But we have also to remember that the journalists, the broadcasters, media, all these people come from our communities and our societies where people don't understand epilepsy. So I think the starting point, as we go to do dissemination and changing people's attitude about discrimination, I think we have to take time and start off with the media people and sensitize them so that they understand. They are also human beings. And we've got to remember that actually everybody out there has got either a friend or a relative, a sister, brother, who has this condition, that when they understand, I think we'll have them on board. That's my contribution. Thank you.
Oh, okay, thank you. I think that was not a question, but a comment emphasizing what had already been mentioned. So I want to thank you a lot, Mr. Dube, for that input and all those that gave input. We were supposed to have a third presentation, which is best practices in engaging governments. And this was going to be presented based on a project, which was the first phase of Utetezi project, which was an epilepsy project that was being done in Mauritius. However, the presenter is currently not in the capital city of Mauritius, but he has gone to another city called Rodriguez, which is another small island. And there he has faced a lot of challenges in terms of connectivity. So he's not able to share with us their experience. But I can highlight that In Mauritius, they've done quite a lot in terms of engaging government. They've worked with the line ministry responsible for disability and social welfare. They've also managed to work with the Ministry of Health, which is key. And currently, as we speak, they have got a draft national plan on table. And they've just been awarded by IBE another grant to enhance that work or complete that work, but also not only do that work in Mauritius only, they are also going to be reaching out to other 3 islands surrounding Mauritius. And in those 3 islands, we're also expecting to have new chapters that are going to be coming out of those islands. So a lot of work is happening in Mauritius, and as IBE-Africa, we are excited about that work. We said that we're not able to give you that presentation about the good work and the good relationship that is there between an organization for persons with epilepsy and the government. So as we now draw close to the end, let me open the floor for any discussion or any questions or comments that you might have had. As I've already highlighted, this first webinar has been recorded and will be able to share with everyone who would like to have a copy of it. And also some other questions that might come after, we'll be able to follow up on those questions and also present them to the presenters or any relevant authorities that might be able to give any input on that. Okay, so let me just highlight a few things that as IBE will be working on in the next coming months in terms of issues to do with epilepsy in Africa. Firstly, let me highlight that we have about 10 countries that we have already awarded some sub-grants in terms of work to continue advocating. And in those countries, some of them are doing work that is going to be model work, and it will be replicated in other countries as they end those projects. And the other 4 countries will be assisting us at a regional level to ensure that we advocate for the adoption of the WHA Resolution 6828 that Dr. Baingana talked about earlier on. We also have other events. On the 21st of October, we're going to have another webinar, and a key discussion will be on the contribution of the African Union in mainstreaming epilepsy in the African health agenda. And one of the directors in the Social Affairs and Health Division will be giving that key speech, but we also have other 2 or 3 presenters also presenting. And we also have an event that is happening in Tanzania. This is an event to do with creation of awareness. We have one of our chapters representative who will be climbing Mount Kilimanjaro for the sake of persons with epilepsy. And as IBE, we are partnering the partners in Kenya that are working with Frederick to ensure that that is a success. We have also a campaign that is going to be launched. We are calling 50 million steps. So as you know, there are 50 million people worldwide affected with epilepsy. So we'll be joining that campaign and ensure that in Africa, we'll also be counting our steps, contributing towards those steps. So countries are going to come up with different initiatives that they are going to put in place in order to contribute to those steps. And also as IBE-Africa, we're going to have a regional campaign that we're also going to organize so that we ensure that we are counting our steps. And the starting of the counting of those steps will be the climb that will be happening at Mount Kilimanjaro. So we are inviting you to join us in our next webinar, which is on the 21st, and we'll circulate the invitation. But what's the take home from all the presentations, the 2 presentations that we have had today? if you saw that there is quite a convergence and link or intersection between the two, the issue to emphasize more on advocacy, and it should be systematic advocacy. And I'm glad to mention also that with support from the Foundation, we are currently developing an advocacy toolkit, which will be used by our chapters or those organizations affiliated to us. It's not only going to be those organizations affiliated to us, it's a document that we're going to share with any other partners working on advocacy work to ensure that we systematically advocate for the rights of persons with epilepsy. So this is some of the good work that is currently happening. We know there are some partners that have joined us today, potential partners, some that want to work with us at regional level as well as in different countries. We are happy to continue this kind of discussions that we've already started with you, and we'll urge you that you join us in this Grand Open as we fight for the rights of persons with epilepsy. We saw the gaps, as was highlighted by Dr. Baingana, that are there in terms of the infrastructure for support that is there, that we need to do more, we need to advocate. So our main responsibility as IBE is advocacy and lobbying. So this then leaves me to thank all those that have been present. We are also, there's a message that has come in that to improve our webinars, we also need to include a bit of French. So I think we'll look into that and ensure that French is also included in the translation of our work. So let me thank our two presenters. First, Dr. Florence Baingana, for your presentation where you shared us the overview or the picture of epilepsy in Africa, the challenges and the areas that we can improve on. And also extend a vote of thanks to Mr. Kudakwashe Dube from Pretoria, South Africa, African Disability Alliance, for your insight in terms of how we can continue working and engaging with media. And I'm glad to mention that we have one representative here from one of the international media houses who are also willing to work with us on a documentary around epilepsy. So we're still around those discussions, and also to highlight additional work that we're thinking around issues to do with funding of epilepsy within Africa, as well as issues to do with frontline workers such as community health workers. How can we engage them to be our eye on the ground or entry point? So we want to thank you, all of you. Getting a message that we have about, on average, 40 people that participated in our first webinar, and we received about 12 apologies from our affiliates, some who were not able to join due to constraints in terms of getting data bundles for them to participate in this discussion. But that leaves me with a bye to all of you, whether it's a morning, afternoon, or an evening where you are. Thank you so much for being part of this webinar, and we're looking forward to you joining us in the future. Thank you so much.